Hello, myself Dr. M.G. Rajnikant, Madurai from Tamil Nadu. So I am going to describe the technique of endoscopic coagulation assisted adenodectomy. This is a 4-year patient with a 6-month duration of nose block, mouth breathing, snoring. Here, the first step of adenodectomy, endoscopic coagulation is a visualization of the adenoid. So we are using a 2.7 mm 0-degree endoscope, and the coagulation wand was introduced to the oral cavity into the nasopharynx. You can see there is a huge adenoid, completely great for adenoid, completely obstructing the choana. Usually, the technique of coagulation removal of adenoid, we start from the choana, from superior to the inferior direction, from the midline to lateral direction. So the usually it should be in by layer. Here we are using the more laterally. So this is the right left side, we are using the coagulation technology. This is the fossa of Rosenmuller deep to the torus tubalis. The main thing is one is that we are coming from superior to inferior, and saline, adequate saline is a must. Here you can see that the saline is inadequate, it's not cutting properly, it's the tissue has blocked that vein, but it should be continuous saline irrigation. The coagulation works through the saline technology. It's a low energy and low heat and radio friction technology with saline. Without saline, that coagulation it doesn't work. So you should have adequate saline irrigation, and the tissue removal of adenoid should be a layer by layer. So here each has different techniques. So my standard technique is we do standard tonsillectomy in a rose position. The same position we are using the endoscope assisted coagulation technique. Here you can, and we should remove the tissue from, I am using from the superior to inferior, medial to lateral direction, and it should be removed by layer. You should not go deeper. You can see when you go deeper and deeper, when you remove the adenoid completely, we see the fascia, buccopharyngeal fascia, and the muscle. So you should not penetrate within the buccopharyngeal fascia. Here you can see in the left side, we have accidentally damaged the buccopharyngeal fascia. You can see the muscle layer. So usually if you go layer by layer, so initially that is a common thing. So you should differentiate the normal adenoid, and you can see here that fascia is there. So fascia you can see clearly in this case, and deeper lower down you can see the muscle. If you damage the fascia, you will see the muscle, but usually muscle is nothing wrong, but usually it bleeds from the muscle. So you have to be very gentle in the layer by layer. You have to remove the adenoidectomy. And usually torus tubalis usually gets hypertrophy in most of the adenoid cases. We use gently coagulation and remove the tissue from the torus tubalis without damaging the extrajective opening. So only lateral, medially we remove, we should not go lateral also. So particularly you want to concentrate in the choana, where usually the adenoid will be the tissue will be there. You want to remove all the tissues from the choana, which is the culprit for the nose block and mouth breathing storing in the most of the cases. So here we are using a 2.7 mm scope. That is we get a narrow visualization. But in case of 4 years child, it's better to use a small scope without damaging the turbinates. And before introducing the nasal scope, you gently decongest the nose with the xylem drops, and sometimes very rarely we pack the nose before using the visualization. So here the adenoid is completely removed from the left side midline, and we are checking from the left side also, so right side also. Right, you can see minimal adenoid from the choana and torus tubalis and the fossa rosemuller. The advantage of this technique is that we are visualizing the complete adenoid, and it can be removed completely without any residual tissue, and the chance of bleeding is very less if you do this technique. In curette, you usually curette the adenoid and pack it, but here there is a, we usually completely remove the tissue along with the very minimal blood loss. This coagulation technology primarily works with the radio frequency and the saline. So saline irrigation is a must. If you don't, if the saline doesn't flow, the van get damaged. So you have to be very careful in the coagulation assisted adenectomy. You should have adequate saline irrigation, and you go for the adenodectomy by layer, ablation of tissue by layer. Don't go deeper also. You scrap it, remove the tissue by layer, so that it will be more useful. Here you can see the post adenodectomy. You can see the buccopharyngeal fascia. Left side, I have small tissue damage. We can see the muscle also. Thank you for watching this surgical step.